Friends, I'm Dr. Chef Shahid. Last time we discussed about one of the case history, and I told you that we will try to give some clinical data on this case. Actually, every case has its own finding. My job is to give you basically, the psychological data so that you may be able to apply it in your practical life. Actually, each and every case demand lot of discussions. But here, my job is just to connect with the client and the basic factor in it. That one. So I'm just going to give you some definition of Bell palsy. Bell palsy is an episode of facial muscle weakness or paralysis. It is on one side of it, and it suddenly appear, and then it has no. There is no definite. I may say, as told you, reason for it, and it doesn't comes. And goes. It takes a maximum time. This client has still under treatment for the last 4 months, and pain and discomfort mostly occurs one side of the face, and the other side is the quite working in normal conditions. So it is a very a painful condition for the client because he is unable and he is restless. What to do? Because one side is weak, he want to control. The more he want to control, the more there is a reaction. I told you last time how the parasympathetic nervous system and other system work in that one. So what happened that due to this reason, his face is droopy. He looks very different. When I asked him what happened, he said that the very first time when he has this, I may say, attack, he was afraid to come out of the, I may say, room. He was hiding his face. He did not even want to see his face in the mirror. So it was a very, very uncomfortable kind of condition. A person like his experience and background, you can understand it. So that effect, and it has a negative effect on the brain because the more one is under this condition or this strike symptom condition, the more he is feeling helplessness. Just imagine a person who has all the power and he is unable to control his own senses. Then how he feel it? Because an ordinary person doesn't understand the depth of these things. So what I wish to say is that in this respect, mostly there is a lot of research on it, but there is a condition which make this mechanism function disintegration effect within the cerebral palsy in the brain. The more important part which effect in this respect is our this hypothalamus part, because it connect and disconnect and lower and upper system and keep the balance in that. Mostly it has been seen that the stress, sleep deprivation, physical trauma, minor illness or automatic syndrome problem suggests that there is a more deep kind effect in this Bell palsy. My main concern in that respect is when I talked to this gentleman about this condition, he said, Dr. Saab, I am very at a loss. I'm such a strong person. I used to teach, control, motivate the people. Now I'm at the mercy of the circumstances. What should I do? Reason is this. I keep on sitting at home in the closed room and keep on going into my case history to see what has happened with me and why I am doing this. Then due to the anxiety, tension, and sleep disorder and various kind of these traumas, he said that I keep on looking the negative thing I have done in my life, mean what bad thing I have done, how I treat the people, or where I have done some physical wrong thing. So he was feeling guilty in that respect. Then he said that how is it possible? I'm an educated person. I want to know a person with the normal, I must say, functions. His own brain, his own body is not in his control. How is it possible? Mankind claim a lot that we are this, we are that. Then he discussed with me about the religious aspect. First of all, I told him, just listen. If you know the nature, what is nature? The nature which we got knowledge, it is people own research, psychology. But I told him, you go and study 14, 50 years back, the Creator book, And you will see from the origin till end, he has just given a various kind of warning to the mankind. So when I was talking to him, he said, how is it possible, he said, that on the day of judgment, the person who is facing all these problems, their own organ will talk against him. Then he discussed with me, now I understand it. If I am normal person in a normal life, if I cannot control my own self, then how is it possible on that day when my own body will talk against myself? Now I realize this is possible because he is living in a condition. On the one hand, he is living like a condition like a normal, strong person. On the other side, he is helpless person. He say, I feel a state of helplessness, like a person who is hanging. Neither I can go this way, neither I can go that way. So as a result of it, I was feeling so uncomfortable. Then he said, would you please tell me what are the main those things which is affecting on the mankind in this respect? Then I start talking to him.